If you ask me the name of one disease which everybody knows about it, I will not name diabetes, I will not name even heart disease, hypertension or malaria. Apart from COVID, if there is a disease which everyone has heard of or knows something about it, it is depression. According to research on Indian population, about 5% of our population is suffering from some degree of depression. Okay. Depression is more widespread in the age group of 40 to 59 years of age. It's surprising that middle age group, which we all perceive as mentally, emotionally or economically strongest amongst us, are suffering from depression. Depression is more widespread in females. Also, depression is more common in bigger cities. People suffer from depression in cities like Delhi, Mumbai, Kolkata more than in smaller cities and villages. But do you know that there are some situations when even a doctor thinks that you are suffering from depression, whereas you do not? It may be possible that many of us are diagnosed with depression or even are taking some medicine for it, but in reality it was something else which never required an antidepressant pill. Interesting, isn't it? Let us see what are those conditions. First of the condition mimicking depression is a thyroid disease. Many undiagnosed and untreated cases of hypothyroidism, which is a common thyroid disease, they will behave as if they are suffering from a mental depression. Once these cases are treated for thyroid diseases, all of their symptoms of depression just disappear. Second commonest condition is the deficiency of vitamin D. Nowadays, this deficiency is very common in our society. Again, once it is diagnosed and treated appropriately, person comes out of all the symptoms of depression. Another condition is other hormonal problems. They are Cushing disease, hypopituitarism, menopause in females, etc. The patient looks like a patient of depression, but instead suffers from these hormonal problems. Many a times, deficiency of some salts in body can also lead to depression-like disease. It may happen that a patient is ill. He gets diarrhea, vomiting or fever. This leads to loss of water and salt from body. If that patient takes a lot of water but does not take enough salts, he can suffer from salt deficiencies and can mimic a patient of depression. Sometimes drugs used to treat vomitings can cause depression-like symptoms. It can happen in a young adult due to some reason patient gets vomitings and a drug is given to stop such vomitings. And patient will look like as if he is in depression. Then there is a long list of medicines if a patient is taking or for some other disease. These medicines can also lead to depression-like symptoms. If something like this happens while taking such medicines, it's simple to treat. Just tell your doctor about these symptoms and he will change the medicines to some other drug. If you feel that you have learned something new by listening to this video, which will be useful to help you or someone else in future, please subscribe and press the like button.